Hey, what's up guys? This is Reed with Rapid Response Training, and I'm here today doing a little video on some everyday carry medical kit. So, of all the things that we can be prepared for that are real emergencies, it's pretty common knowledge that statistically the most common one is going to be some type of injury. So being able to treat injuries or have something with you to treat yourself if that immediate care isn't available is frankly a super smart idea. And we're all about carrying guns and because I might need it to fight, right? So if there's a gunfight, turns out people are probably going to get shot, and maybe that's me, or maybe that's the bad guy plugged somebody that if we can save that person, that would be a good thing. So, but also just car wrecks is the most common one, in accidents, things of that nature. So carrying medical gear on your person is important. You can reference my everyday carry video. I'll link it in the description if you want to see all of it, but I'm going to go into detail in this video. So I'm going to talk about three main things. First thing is Tourniquet, and this is with a Philster flatpack. All right, here's another Philster thing. This is not a Philster ad, I promise. Philster Medical Wallet. And then ankle IFAK, or medical kit. This is from Ryker Nylon. So I guess I'll talk about these things broadly, and then I'll see if I can do it tabletop and go through what's in it and why, and get in a little more detail. So tourniquet is super important. Borderline impossible to fabricate one if you have a legitimate hemorrhage from an artery, right? So if you have a major artery, a brachial, a femoral, something like that, you've got about 30 seconds of consciousness. So trying to fabricate something is probably not going to work, especially if it's brachial, because you are probably down to one hand to make that happen, right? So tourniquet's super important. It's also one of the major injuries that will kill you that is survivable with intervention, right? So there's a lot of getting shot right in the face, in the brains, that probably is not survivable. So I'm not going to carry a bunch of stuff to treat that, right? So but when it comes to survivable injuries that we can treat, that's what we're focusing on. So tourniquets are a big one. If we've got a major hemorrhage in an appendage, this can kind of solve that problem. So that's big. And then so this is a constant. I've always got a tourniquet. This happens to be a soft T wide. And then the Philster Med Wallet. The reason I made this is to carry more than just a tourniquet when I got shorts on. This obviously ankle med kit, this is not coming with me when I'm wearing shorts. I'm a nerd. I don't want to look like a nerd. I don't want to give it away, right? Secret. So put this together, and this is kind of a bare minimum for me to go with a tourniquet. This is bare minimum. And if I've got pants on, I've got all this. So and then so this is it's thick. It's thicker than you'd want to sit on, but certainly there's dudes out there with big old bifold wallets that are at least this thick. I carry this in my front left pocket, and honestly, super non-issue. I could go without it when I've got pants on, because I got this, but why not just have more, right? So more meaning more injuries or more patients, or if the wound is more severe, I might need more stuff, or maybe I make a mistake, right? So, and I'm oh, I misapplied that, but good thing I've got more, I can do it right. So, or if I have to move the patient and it gets messed up, right? So there's a lot of reasons. So I've got that, and that's what this is good for me personally. That's where I see the use of this is like a front pocket. Or if you've got like some hidden side pocket, you can maybe do that, but it is pretty thick, and it's, you know, 4 inches wide, 4.5 inches wide, something like that. Oh, maybe less than that. I don't know. Whatever. Insert joke about not knowing how many inches are. Yeah. So then the ankle IFAK. This is from Ryker Nylon. This is like, you can carry the most stuff in it. The downside is it kind of gives you cankles a little bit, but you know, people don't generally look at your ankles, so if they see it, they might be like, that looks weird, but they're not like putting together why it looks weird. And I can carry a lot of stuff in here, so anyway, yeah, I guess that's the reason why I carry this stuff. I'll talk about, yeah, so some pluses and minuses. Philster flatpack. Here's a minus. It really isn't that slim. It's called a flatpack, but if you take and flat fold this tourniquet with just like Ranger bands or rubber bands, it's actually slimmer. The upside to this is I can get to it one-handed, right? I can pop those elastic bands off and get to my tourniquet. Whereas if I've got it all wrapped up in rubber bands, I don't know if I'm going to be able to do that one-handed, right? Especially if I'm like actively bleeding. So that's a nice touch. It comes with like belt loops and stuff. There's like putting this on your belt is like, it prints more than the pistol. Like I just took all that off there and it's just slick, and I've got it in my pocket. So that's how I use that. And then I wear the Vertex jeans that they have the hidden side pocket, and that's where I keep that. So pluses and minuses to the Philster flat pack is this is literally just like an elastic pass-through wallet, right? It's like one big like one big hole, so to speak. And then it's got like 1.5 dividers in here. So the downside is like getting stuff out of here isn't super great, and it's pretty limited on what you can carry. The upside is like, it's obviously the form factor, right? So, and again, just like with a pistol, I need to get this stuff out fast. I don't have to get, I may never have to get this stuff back in here. Like if this is covered in blood, I'll throw this away, right? So, but yeah, like getting the stuff out may or may not be the easiest thing in the world. But like I have it. So what's the trade-off there? The ankle med kit, personally, I don't find this super comfortable. Maybe it's this one. I don't know. I've worn the hell out of this thing. You can see it's got holes in it. But I use the boot extender. It's got some flex in it. It's elastic. So some people don't. I don't put it around boots, but I don't know, maybe my calves are just that big, but I find that's good. The wear is normal for like, I don't know, almost 10 years of like literally everyday use. Because I wear pants 90% of the time. So, and I like it because you can carry a lot of stuff in it. And yeah, medical's big and bulky. It's hard to like, you can get away with like minimal stuff, but it's hard to carry like real med kit. So ankle carry seems to be like the best when it comes to that I've found. So there's some pluses and minuses to those things. There's other there's other like wallet type things. Like LTC has a cool one. There's some others. I guess like having all the features is really nice, but I wouldn't want to add features that make it bigger. The whole point of this for me is that I can like disappear it. So, and then like I'll actually carry it in shorts, like with a t-shirt. So, and then the Ryker Nylon, there's other ones of this, and I would be interested in trying, I think like I think SFD maybe has one. I know Special Operations Equipment, SOE has one that's all neoprene. That's kind of cool. Galco has one like that. So yeah, something like that where it's like a little bit more stretchy and yeah, I think a little more stretchy is kind of how I think that would be good. So, and this one has like specific pockets. Like obviously, this pocket is specifically designed like to have a needle in it. So, I don't know if I need that. Like, give me general pockets, and I'll like smush whatever in there I want in there. So, but I'll see if I can do the tabletop and talk about what's actually in here, and yeah, we'll do that. All right, guys, so I'll talk about the tourniquet first. Here's the soft T wide. You can see I've carried the heck out of this because all the, like I've worn off some of the aluminum texture there on the windless. So the reason I picked this tourniquet is kind of controversial, but I picked this tourniquet because I want a windless tourniquet, but I wanted one I could pocket carry and that would kind of disappear. So that's a big plus side to the, for some reason my camera's not wanting to focus, but that's a reason for the soft T wide over the CAT combat application tourniquet. I think soft T wide is Special Operations Forces Tourniquet wide, because they used to make a narrow one. I think they're all wide now, it doesn't matter. They make a new version of this that has a like some little wing brackets, which make it really good for one-handed application. So I need to retire this tourniquet, make it a training tourniquet or a backup, like put it in a kit somewhere, and then put the upgrade generation in here. So that is a downside, is this tourniquet is much more difficult to apply one-handed compared to a CAT tourniquet, right? North American Rescue CAT tourniquet. So that's the deal with that tourniquet. They make elastic tourniquets. The best one that I've seen is the Rats. Personally, I don't find it that difficult to carry a windless tourniquet, so I'm carrying a windless tourniquet. So those tend to be better. Maybe I'll add a, I don't know, maybe I'll add a Rats in as well, like for my kid, because windless tourniquets can only go so like around extremities that are so large. But yeah, that's why I carry that. If you want to carry an elastic, fine. I would just be cautious to make sure that it works, like it actually works. Like you take it to a class, you apply it a bunch, you have people try and find your pulse, you put a pulse ox on, etc., and you confirm that it actually works. So there's a whole thing about TCCC approved. I don't care about any of that. Like, that's nice to have. I just care that the thing works, not that like some government organization approved it for sale and purchase, right? So, or purchase, I should say, to like the government. So, because I'm not the government, so I don't have those same specifications. Anyway, that's tourniquet. We'll talk about the Med Wallet now. Here's what I have in the Med Wallet. So, I have right here, right on top, I've got a pair of gloves, and I have a Nasopharyngeal Airway. So the airway obviously is for issues breathing. So that's why I have that. It goes in your nose and it kind of gags you. But yeah, it's important if there's some sort of an airway issue. I have some compressed gauze here, and I've got tape on here, one, to like help pull it out, and then two, I've got this package pre-cut. So the tape is there to show me where to grab this thing and tear it open, and then B, like give me a little extra handle. So that's what that's for. Obviously, like for packing So, and then one more thing in here is a chest. Oh, two more things. I've got small 4x4. I guess there's two in here. Hemostatic gauze pad. So this is not as good as like regular like combat gauze, but combined with the traditional non-hemostatic gauze, I can pack this first down into the power ball and add this on top. And hopefully I kind of get that effect where the hemostatic is like down where the bleed is, which is followed up by just pack of the regular gauze, right? So, because I can't carry both in here, right? And then lastly, I have a chest seal. So I'm a big proponent of chest seals. I don't think they get enough love because what gets all the love is tourniquets, but contextually, like where this came to place was the global war on terror, and tourniquets were saving 1,000 lives, and like they became a thing, right? Like they weren't a thing, and now they're a thing. Like everybody has one basically, which is great. I love seeing it. But the reason they were so influential in global war on terror was they were coming up with so many saves. Dudes are wearing body armor. So the majority of the survivable injuries are to the extremities, right? So that doesn't apply for like probably whoever watching this, you and me. We don't wear body armor on the daily. So penetrating trauma to the chest is a larger concern for us because we're unarmored. I've put improvised chest seals on dudes and it sucks. I don't ever want to have to do that again. I want a purpose-built thing that like works and like works good. So having a real chest seal, I like a lot. I don't like the, frankly, I'll say lazy method of just throwing some duct tape in the package and being like, that's our chest seal. Just use the packaging of the gauze and the duct tape. Like, I did that and it sucks. So, anyway. Yep, so I'll load that later. Who cares? Doesn't matter. So here's the Ryker kit. One cool thing about it, it's got this pocket in the back here where you can put chest seals and stuff like that. So I think that's a really nice feature. And it's got 3 pockets. One's the needle pocket, obviously. So chest dart for tension pneumothorax. That's pressure in the chest. Oh, I forgot to mention the chest seal hopefully will prevent sucking chest wound, right? So penetrating trauma to the chest, seal a box, that's what that's for. And then if that like doesn't work or whatever, maybe there's a pressure pneumothorax, tension pneumothorax, needs to be decompressed. Here's a needle. This is controversial because this is outside scope of practice for pretty much everybody except for like paramedics, and then they have to be following like 1,000 rules. But getting back to the whole point of a individual first aid kit is like the individual part is this is supposed to be used on me. So I don't know, maybe somebody's putting this dart in me. I would like to have it. If I need a dart, I mean, shoot, I don't care. Like, if I really need chest decompression, dude, I'll like talk, like somebody can just try it because I'm probably going to die if I don't get it. So, I mean, what's the worst that could happen, right? I don't know. That's kind of the way I see it. So I have one of these. If you're like, I don't feel comfortable legally, like don't carry one for all, I don't care. But you know, there's a lot of paramedics out there and they don't carry this stuff. Like on duty, they might have some of it, I say, because like I've come up on a motorcycle wreck and handed one of these to a paramedic who didn't have one. So, and he was on duty. So anyway, carry a needle or don't, I don't care. Get some training. Well, that goes without saying, but I'm going to say it later. So that's the needle. If you're like you shouldn't have that. I don't care. I don't know. Sweet mother. What excellent camera work. What fine camera work I'm doing here. So coming over here, I've got a couple safety pins. So this is nice to secure like ends of bandages. The like Israeli type bandages, they're terrible for like the little plastic clips break on them and everything like that. Also, if I don't have an airway, you could keep somebody's tongue from falling back in their throat with one of these. You can replace a grenade pin with one of these if you like pulled it out and then you decide you don't want to throw it. So yeah, a lot of uses for safety pins. So I've got 2 big safety pins there. I have my hemostatic gauze, my rapid ribbon for packing, and then obviously the hemostatic specifically is to be used for like junctional areas where I can't use a tourniquet. So I've got that, and then I have my this is a super micro compression, what do you call it, pressure bandage. So I think there's a little gauze pad in the middle. No, maybe not. Maybe this is just an ace that I threw in here. Could be an ace, who knows? But either way, that's what I'd use it for, is a pressure dressing. So like if I have to pack a wound, like in, I don't know, wherever, and then I need to keep that packing material in there, I would compress it with this, and then I don't have to keep my hand on it the whole time. Like I might need to move this person or whatever. So, yeah. And then this front pocket, I have a cat tourniquet and a, what do you call it, Nasopharyngeal Airway, and I have a set of gloves. So, black gloves, not ideal, but these are some that came with the kit. Personally, I prefer like blue because they are, you can see blood on them, but it might be nighttime, I can't see it anyway, whatever. So yeah, gloves are important because people have diseases, so protect yourself. Don't go save the day and then get AIDS and not be able to bang your wife. I've got an airway in each of these because I may be carrying just the Med Wallet, right? So that's kind of the reason for that. It's not necessarily because I need 2. The multiple tourniquets is because I want to have multiple tourniquets. I will go with one, like I'll make that sacrifice and just carry one if I've got shorts on, because like, you know, we just make those sacrifices when we go about our day-to-day. But yeah, I want to have 2. I have 4 appendages. There might be multiple people, and also people with legs over like 25 inches in diameter, I believe. The vast majority of them need 2 tourniquets in order to fully occlude blood flow. And it turns out we live in America and a lot of people are fat and have legs over 25 inches. And then also, like, if you're in sort of a professional context, like you've got big dudes that lift weights, right? And they have big muscular legs that are over 25 inches in diameter. So multiple tourniquets, especially multiple windless tourniquets, I think is important. So let's see, talked about hemostatic agent. So specifically for junctional areas, armpits, groin type, neck areas, things I can't turn. Yeah, you can't tourniquet a neck. I mean, you can. Yeah, let me know how that goes. But so pack this in there, get a little bit extra, extra clotting and whatnot. So some regular gauze, some more hemostatic, chest seal, talked about the importance of that, talked about the needle for 17 hours. This, I think, is one of the least important items, is the pressure dressing. So I can improvise a pressure dressing pretty easily just by like tying something around it tightly. I could even take a tourniquet and apply it not tight, just to add pressure, not to actually like tourniquet. Tourniquet, is that a verb? Doesn't matter. Or like I can just hold pressure, right? Or if I've got like, you know, the family member, the bystander that's freaking out, this actually works really good, is to give them a job to do, right? So giving them a job like, hey, put your hand here, hold pressure, can be very effective. And so that can be something good. Now, I don't know, sometimes they get in your way, is what it is. But if I had to leave one thing behind, it'd probably be the pressure dressing. So regular gauze, also relatively easy to improvise, like tear up a t-shirt or whatever. Like packing, I think having a piece of gauze is probably good to get you started. After that, I mean, I could pack this into something. Like it's not that that crucial. But the cool thing about gauze is this, let's see if it says the size on here. Yeah, it's 4.1 yards of gauze. Okay, so that's a big difference, where it's not a gauze pad. It's not a 4-inch piece of gauze. It's 4.5 inches wide, but it's 4 yards long. Okay, so that's kind of the deal with that. And you're gonna notice a lot of this stuff is like, the packaging is kind of open on these Nasopharyngeal Airways, stuff like that. Should I replace some of this? Yes, but am I worried about the sterility of the items? I am not. Whatever made the hole was not sterile in the first place. They're gonna go to the hospital and be there for a while and get like all the antibiotics and kill every good bug that's in their system anyway. Don't really care about that. I care about getting them to the hospital alive. So that's kind of the deal with the everyday carry medical kit. I would say if you're going to carry, one thing, carry a tourniquet. All right. If you're going to carry two, carry a tourniquet and a chest seal. And this is going to be controversial, but if you're going to carry three, make that third thing a needle. Okay. The reason is you cannot improvise a needle, right? So I can improvise a tourniquet, probably realistically not, maybe not for myself, but I could maybe do it for somebody else. Or maybe if I have if I've got a wound, but it needs to be tourniqueted. I gotta put one of these on. But it's like it's a small hole, so it's spurting bright red blood, arterial blood, but it's super small, and like maybe I've got some time to fashion something, I don't know. Chest seal also can improvise. I can't improvise this. So and again, maybe I'm not using this. You're like, Reed, I'm not certified to use that. Like, I don't know, man. If somebody's gonna die if you don't do it, I don't know, just thought. But also, like, somebody might be sticking this in me. It might be a paramedic. So anyway, that's what I would say. Make sure you carry gloves so you don't get AIDS. And yeah, if you don't carry medical gear, you're wrong. You're a bad person and you should feel bad. No, I'm just kidding. But seriously, room for improvement. Carry some medical stuff. Get some medical training. Everybody should have medical training. You will use this training in your life. At some point, someone will have an emergency. So, like, I can almost guarantee it. So, get training, carry your stuff with you. You see everybody carrying all their cool guy stuff, and nobody's got medical, or if they do, it's like tourniquet max. So, I know I carry a lot. You don't have to carry this much. Carry some medical, please. If you're carrying a bunch of cool guy stuff and you don't have medical, you're telling on yourself. You're telling everyone that you're not a serious person. So get some medical training, learn how to use this stuff, but carry your medical gear. Don't be weird.